Good morning. Are you Eldon Hoskins?
Yes, I am.
Okay, tell me your birth date.
8/13/1983.
Okay, I guess I've got the right patient then. So I'm the diabetic educator today. My name's Ildiko, like I said, and the doctor told me that you need to be taught how to use insulin because you're going to be giving yourself insulin shots at home now that you have diabetes.
Mm-hmm.
You're going to be on 2 different kinds of insulin, Lantus and Novolog. Do you have any questions so far?
What are the differences between the two?
Lantus is an insulin that you take once a day. You take it at night, usually about 9 o'clock. Well, that's when we give it in the hospital. And at home, whenever it's convenient for you. But the important thing is to take it at the same time every day.
Mm-hmm.
And so, like around 8 or 9, 10 o'clock, but always about the same time, within an hour time frame. And that one is called Lantus, like I said. There's something about it in here. It takes 2 to 4 hours to start working,
Mm-hmm.
and then it just continues on for 24 hours and works until the next time you take it. It works steady all the way through the 24 hours, and it keeps your blood sugars down for the whole 24-hour period.
Mm-hmm.
And that's called your basal insulin because it sort of gives a base of controlling your blood sugars. And the other kind of insulin is Novolog. Novolog is a fast-acting insulin. You take it before meals. It starts to work in about 10 minutes, and it continues to work for 3 to 5 hours. The strongest effect is within 40 to 50 minutes. But the important thing about the Novolog is you want to have it ready to go and have your meal right there, and then give yourself the Novolog, and then go ahead and eat, because it works so quickly that if you give yourself the Novolog and you walk away and start doing something else and don't eat, your blood sugar could drop and you could have a hypoglycemic reaction, which means your blood sugar would be too low and you could get dizzy, you could even pass out.
Mm-hmm.
So, or if you're going to skip a meal, like if you are leaving for work and you think you're going to eat breakfast, but then you don't, you say, oh gosh, I don't have time. Don't give yourself the Novolog. Just go on with it and then do it before lunch then. So, any questions so far about the 2 kinds of insulin?
No.
Okay, so your orders say that it looks like you're going to go home on 20 units of Lantus every night and 5 units of Novolog before each meal.
Alright.
Okay, so here's what the insulin pens look like. And I just brought this just to show you something. There's 50 units in each of these insulin pens. 50 units, but you're just going to use 20 for the Lantus and 5 for the Novolog. So to demonstrate how small a unit is, this is a regular other syringe that we use for other purposes, not insulin. But here is 1 milliliter right here. So that much is 1 milliliter. This has half of a milliliter in it, and each unit, there's 100 units in 1 milliliter. So that's how tiny these units are.
Okay.
That's why it's so important to be really exact with it. So I'm just going to demonstrate how you do it the first time. You take off the caps, and then let's pretend like this is just normal saline. It's not real insulin. We're just using this for practice because I'm not going to have you give yourself insulin at this time. I'm going to tell your nurse to give you and let you give you your own insulin every time you take it till you go home. So you'll be practicing before you go home.
Mm-hmm.
So let's pretend like you're going to give yourself your Lantus. So you go past the 20 and to get some air in there, and then you stick it down in the bottle straight in. This is a really fine pen, so you have to get it right in there. Well, it bent. We can use a new one, no problem. So we stick it straight in. we pull it back and draw up our insulin. Well, look at that, I forgot to put the air in, didn't I? It threw me off when I bent my needle. Okay, so we put in our air. It makes it hard to draw the insulin if you don't put the air in. So you can just see how I did that, and it was hard to draw it out. So we pull it out, and you go a little past the 20. You can go down to 25 or 30 if you want. Then you go right back up to the 20. And the reason that we draw back past the 20 and go back up to it is to get rid of any air bubbles. Because if there was an air bubble, it wouldn't hurt you, but it would make not the right amount of insulin in there. So, because I always tell this story about the reason I always explain that it won't hurt you, because one time I was teaching a patient and he hadn't been taking his insulin for a month. And then when I got to talking to him, it was because somebody had told him about that air bubble, and it made him so afraid that he didn't want to take his insulin anymore because he thought the air bubble would hurt him. So, but anyway, so there's the 20 units, and I'm just going to push it back up in there, and I'm going to let you do it now. So be careful. There's your needle. And you remember, oh, okay, you're doing real good. Okay, you're doing really good. Then when you think you're on the 20 and you've got 20 units in there, just show it to me and I'll see if it looks good. Okay, perfect. All right, just squirt that out if you're done. And then I want you to do it up again and do it for 5 units. Just to make sure you've got your technique down. It looks like you're doing really good, so I'm not too worried. Got 5? Mm-hmm. All right, take it out. Let me see. Okay, great. All right. Well, then you'd be ready to give yourself your insulin. Okay. So there's several places you can give. I'm just going to recap this. Just lay it over here. There's several places that you can give yourself your insulin. Here in the hospital, they've probably been giving you your insulin in the back of your arm, haven't they?
Yeah.
Okay. That's really convenient for nurses to give you your insulin there because it's easily accessible. You don't have to lift up your gown or anything. But at home, most people give it to themselves in their stomach or in the tops of their thighs, or you can give it to yourself back here too. And so you want to stay 2 inches away from your stomach. Here's a little picture in here showing the different sites where you can give yourself insulin. So you're giving it in the subcutaneous tissue, which means right under the skin where there's some fat, because the insulin absorbs best in fat. So